So what, we get drunk. So what, we smoke weed. We're just having fun. We don't care who sees. So what, we go out. That's how it's supposed to be. 'Cause you know I'm high as fuck. Young and wild and free.
Next patient.
What up? I got Naskin here with me. This ain't a diss song, but yeah, you know what it is. I'm a cheesehead, y'all niggas cheese whiz. Pittsburgh Steelers, that's nothing. That Super Bowl ring, that's nothing. Pull up in your town when you see me, you know everything. Green and yellow, green and yellow, green and yellow, green and yellow. I put it down.
Please take a seat.
Big G's on the helmet, steel curtain. What is that, velvet? And if we win, I'ma throw a Super Bowl party and blow a cigar like Vince Lombardi.
Come. Sit.
So, what is the problem?
My son is addicted to marijuana. I found it out 2 months before.
How long has he been smoking?
Maybe 1 or 2 years.
No.
Big G's on the helmet, steel curtain. What is that, velvet?
How many times do you smoke per day?
5 to 6
Yeah, you know what it is. I'm a cheesehead, y'all niggas cheese whiz.
So, do you have any nausea, vomiting,
Yes.
Dizziness, diarrhea, dizziness? Okay. What about diarrhea or constipation? Okay. Do you have migraine,
Sometimes.
headache? Do you have pain anywhere else in the body? Okay, back pain. So, there are no treatments for this, there are no pharmacological agents. So, we will start him on baclofen and Vistaril. So, this will help him in reducing his withdrawal symptoms and his anxiety, nausea and vomiting. And I will also refer him to an occupational therapist. So they will give him massage therapy and exercise therapy and art therapy. This will make his life more graceful.
The first drug we are prescribing is baclofen. So it is a GABA agonist. It is a muscle relaxant and antispastic agent. It helps in alleviation of spasticity resulting from multiple sclerosis. It is a general CNS depressant and is rapidly and extensively absorbed and eliminated. Absorption is primarily dose dependent. It is rapidly absorbed after oral administration and is distributed widely throughout the body. Biotransformation is low and the drug is predominantly excreted unchanged by the kidneys. It is administered throughout the day to control spasticity appropriately. So, baclofen is a direct agonist at the GABA receptors. It causes hyperpolarization of afferent terminals and is capable of inhibiting both monosynaptic and polysynaptic reflexes at the spinal level. It is excreted in the urine, and its half-life is 1.5 to 4 hours. The second drug we prescribed was Vistaril. It is a benzoid. It is a piperazine antihistamine structurally related to glucazine, cyclizine, and meclizine. It is used to treat histamine-mediated pruritus, and its active metabolite is cetirizine, which is also used as an H1 antagonist. It is administered orally or via IM injections. It is primarily metabolized in the liver, and the main metabolite is cetirizine. Effects are observed within 1 hour of administration. The other metabolites identified include N-dealkylated metabolite and a no-dealkylated one. So how does it work? It competes with histamine for binding at H1 receptor sites on the effector cell surface. Suppression of histaminic, edema, flare, and pruritus. The sedative properties of hydroxyzine occur at the subcortical level of the CNS, secondary to its central anticholinergic actions. It is rapidly absorbed from the GIT. It is excreted in the urine, and its half-life is 20 to 25 hours.
Sony and Dr. Strange, I'll be handling your husband's case. So, Dr. Anjali, please read me the case.
Mr. Sony, 23 years old, suffering from chronic Nubain overdose, admitted 1 hour ago, and is suffering from shallow breathing, dizziness, nausea and vomiting, dry mouth, headache, bradycardia, drowsiness, and no positive signs of allergic reaction. Patient has no history of asthma, liver and kidney disease, no history of mental illness, and no recent heart attack.
So why was he taking Nubain?
For migraine.
So is there any other history of drug abuse?
No.
Is he on any other medications like sleeping pills, cough medications, muscle relaxants, or anything?
No. He's only taking he's on cough medication.
Please proceed.
We should be putting him on naloxone through IV high dose.
Okay. So Mrs. Soni will be discharging your husband tomorrow.
No, doctor. Please come here.
No, he'll be fine at home. Just don't give him any other medications or vitamins, and don't let him consume alcohol. And for his migraine, I'll be prescribing him some painkillers. And also guard him against falls. And I'll be referring him for physical therapy and counseling sessions that will help him to wean from the addiction. And try to make him participate in the family activities and let him do his hobbies as usual. So that's it.
Naloxone is an alkaloid. It is an opioid antagonist. So, naloxone prevents or reverses the effects of opioids, including the respiratory depression, sedation, and hypotension, which are commonly seen in opioid-using patients. It is administered parenterally, and it is rapidly distributed throughout the body. Repeated dosing is required if opioid receptors must be stopped from triggering for an extended period. Naloxone is primarily metabolized in the liver, and its major metabolite is naloxone 3-glucuronide. It antagonizes the activity of opioid effects by competing with the same receptor sites, especially the mu-opioid receptor. Its major route of elimination is urine. 25 to 40% of it is excreted within 6 hours. Half-life, if given IM, is 1.24 hours, and if nasal, it is 2 hours.